Hi, my name's Vicky Robson and I've chosen to look at condition management programmes. I started with, what is a condition management programme? Is it part of a government scheme? Is it a support service? Is it a way to empower people to manage their own medical condition or conditions? Does it last 12 weeks, 6 weeks, or can it be ongoing? Is it only for people of working age who have a job to go to, or can it be for anyone, young or old, with a job or without a job? And there are so many different variants of the condition management plan out there, and I found some that were for anyone receiving benefits, irrespective of how old they are. Some are for people to manage their own medical condition so that they can go about their daily lives, and some are specifically focused on people managing their medical condition so that they can return to the workplace. There are probably many other versions that I didn't come across as well. So my favourite definition or description was this one here. And they described the condition management plan as exploring how your illness or disability is affecting your daily routine and how you may be able to achieve more in life and return to work by fully understanding and managing your health condition. And while I was looking at the condition management programme, I found some alternative ideas, such as the condition management plan, the Wellness Action Recovery Plan, the Wellness Action Plan, and the Expert Patient Programme, which are all similar ideas. So during my research into condition management programmes, the majority of the information I found was in relation to the government's Pathways to Work scheme. Now, Pathways to Work help people to get work if they were receiving employment and support allowance or an incapacity benefit because of health condition or disability. Now, Pathways was provided by the Job Centre Plus and some other organisations, including some voluntary sector organisations. And these Pathways providers were mandated to provide a condition management programme. Some chose to run their CMP in-house and some contracted them out, and they could choose to put whatever content they wanted into these condition management programmes. And as a result, people taking part in the Pathways run CMPs received varying levels of support. I think that the fact that these providers were able to run the CMPs how they liked has meant that there is very little information in relation to the content. And while there is information about the numbers of people that attended and what happened to those people, the research isn't specific to what information or support they actually received. There is, however, significant research into the outcomes that have been published in respect of the scheme, and the findings do suggest that the CMP is an essential part of the provider-led pathways, and it helps people make progress towards job readiness. Now, a link to this research is in the circle, but I warn you it is fairly lengthy. So I next looked at what should be included in a condition management programme, and again I found this relatively difficult to pin down because of the lack of information on the content. But the majority of the condition management programmes I came across were very non-specific, but I did find some with specific components such as managing arthritis, diabetes or bereavement in the workplace. And what I picked out of the CMPs is what I'm calling a list of cornerstones, and they are physical health and exercise, stress and anxiety management, relaxation techniques, and advice and information on lifestyle. Now, I've popped all these down in this little circle, and I asked myself the question, what makes these different from an expert patient programme or just empowering somebody to manage their own condition? And these are all cornerstones of those programmes as well. So what makes it a condition management programme, the way we're talking about it, is the positive thinking about health and work, or health and wellbeing in the workplace, so adding that work component, the focus on work. So I've mentioned the Expert Patients Programme, and while it doesn't focus specifically on work, it does still cover the topics that I've put into my list of cornerstones, and because of that, I think it would probably provide a good grounding for return to work preparation should the Expert Patient Programme be available and a more work-focused condition management programme not be available. And again, I've included a link to the Expert Patient Programme at the bottom of the circle. So the Shaw Trust was actually one of the organisations that provided the most information on their website in relation to a condition management programme. And theirs was a generic 4-week programme, which did include one introductory session, which was 1-to-1, and a final week session, so it worked out as 6 weeks in total. But they were also able to tailor some additional modules to the needs of the person, including the modules I've mentioned on diabetes and bereavement and arthritis, and managing stress and pain in the workplace. So I've also linked to the Shaw Trust's condition management programme information, and if you look in other areas of the Shaw Trust's website, you find even more detailed information the further you go in. So it's definitely worth having a look. So in terms of the research, I thought I'd just drop a little bit more information in. Now these are 2 summaries. One is from NICE and one is another government summary of outcomes. And it's just good to see how important they have been and are considered in preparing somebody for returning to work. Now, I've mentioned both the Shaw Trust and the Minds WAP, and I've added some more information about the Shaw Trust's condition management programme here, and they make a very good point, or a very big point, in saying they're looking at what a person can do, not what they can't do, and people are asked what they want to do, and the programme is tailored to their needs. Now I've added in the WAP information, and the WAP information is slightly different because it's more tailored towards an employee in the workplace. And the WAP was inspired by Mary Ellen Copeland's Wellness Action Recovery Plan, and it was specifically developed in relation to mental health. And obviously Mind have repurposed it slightly to become the WAP, the Wellness Action Plan. And again, it is in relation to mental health. However, having looked at it, I don't see why it couldn't be used for anybody else's medical condition, whether it be psychological or physical. And they've said that all staff should be offered a WAP, regardless of whether they have a mental health problem or not. And that is, so current that there should be a lot more focus on people's wellness in the workplace. I've said the WAP should cover actions and behaviours that support an employee's mental well-being, symptoms, triggers and early warning signs of poor mental health, potential impact of poor mental health on the employee's performance and what support is needed, and positive steps for the individual to take, and obviously agreed review times because they can often be missed. Importantly, the employee should draft the WAP with the support from their GP or whoever their healthcare provider is, and it is also essential that the WAP is discussed with and has buy-in from the employee's line manager, and the WAP link is just there on the side. Now, it interests me that charities, I think, used to be more set up to support people outside of the workplace, but you can see here from the Shaw Trust and Mind that they are focusing on achieving work as an activity of daily living. And I've seen this across other organisations, charitable groups, including Maggie's Cancer Centres and the British Heart Foundation. Now finally, I had a look at condition management plans. And when I first started looking into condition management programmes, I actually took the topic on because I thought it's the same as a condition management plan. And I thought, well, what's the difference? But it became apparent that they're sort of the same thing. They have the same goal, but they are different. And a condition management plan is more focused on a specific workplace, or does require a person to already be in work, or at least know what type of work they're going to go into. And the WAP is along the same lines, and it is important that these are designed by the person or the employee in conjunction with the line manager. Now at the bottom here I've included a condition management plan that we use at Unum with my employer to support the employees that we work with. And I've actually filled it in, and I've based it on a situation that I was in a few years ago. And I think I would have found it useful at that time to have had the opportunity to do one of these, but it was never discussed. So it's actually quite nice to know it's there, and I might set one up for myself going forwards. So that is everything I've put together on condition management programmes, and I hope what I've put together is of use for you. But please don't hesitate to ask me if you have any questions or would like a copy of the condition management plan template that I've used here. It is something we put together at Unum, so I can pass it on. And thank you for listening.